Hey everybody, happy holidays from Sterling Center Bariatrics. I haven't talked to you in a couple of months and people have been after me to make you another video, so here we go. If you look over my right shoulder up here, I'm just past the 6-month point now on my surgery. I've lost 63 pounds. As you can see, things look a little different. I'll tell you right off the bat, I feel great. I've been out walking. You have to change how you eat and you have to stick to the plan. One of the most frequent things that I get asked is, how fast should I be losing weight? Well, first of all, people are never satisfied with how quickly they're losing weight. People can lose 4 pounds a week or a quarter of a pound a week. It does not matter. They all want it to be faster. Me too, I get it. But the bottom line is, when you look at how fast people lose over the first 3 or 4 months, it's all very, very similar. Somebody who has 200 pounds to lose versus somebody that has 100 pounds to lose, the percentage of their excess body weight that they're losing is pretty similar. So after that, it does slow down. Now I'm losing about a pound a week, which is pretty much where I want to be. But it is entirely based on how much work you put into it. It's like anything else in life. You get out of it what you put into it. You stick to the food plan. We're going to stay away from the bread, potatoes, rice, pasta, corn, butter, beans, peas. We eat a low carb diet with good vegetables, good protein sources, and good fats, and you will continue to lose weight. Now, the things that we offer here at the Sterling Center all fit in with the same kind of dietary approach. You're not on a diet, you're on a food plan. We help you with giving you good examples, good choices to make, but you're responsible for the foods you choose. People always hear me say, you're responsible for what goes in your pie hole. That's correct. You're responsible. You make good food choices. You read the labels. And this is how you're going to get through the holidays too. But you're still responsible for the things you eat. Now, it's Christmas. You know, we just had Thanksgiving. New Year's is coming up. We want you to enjoy yourself. You have a good time. You do your family get-togethers. You eat the things that you like, but you do that in much more moderated amounts than what you used to do. Because trust me, with a sleeve gastrectomy, with an endoscopic sleeve gastroplasty, with an Orbera balloon, with a gastric bypass, you're going to fill up very quickly. And so you need to make sure that you're getting in the good stuff first. And I really mean the good stuff, not what people usually think about the good stuff. I mean your good proteins, your good fats, your complex carbohydrates. And then you'll be full and you won't even care that you didn't eat, 3 pieces of cheesecake or whatever your thing is at Christmas. Have a bite or 2 of it. But at that point, you're going to be full and it's time to quit. Okay? So every year we hear the same thing this time of year. What do you offer? Who's a candidate? How do you get in the program? So the things that we do here: Orbera Intragastric balloon. It's a balloon that goes in your stomach. It's inflated with saline. It weighs about 1.5 pounds. It stays for 6 to 8 months, and it reduces the amount that you can eat when you sit down at the table. It's a temporary thing. It has to come out. Statistically, the longer you can keep that weight off, the better you're going to do, but it's because of what you eat. You stick to the food plan, you stick to the exercise plan. The next thing would be an endoscopic sleeve gastroplasty. We look down with a light, we can suture the inside of the stomach, and we make it smaller. It's not as good as far as weight loss goes long term compared to a sleeve gastrectomy where we remove part of the stomach, but it's still pretty good. The balloon and the sleeve are for patients with a BMI from 30 to 40, okay? 30 to 40, a little bit lower on that low end compared to the incision options, the surgical options. So that's a balloon and an ESG. Another thing that we can do endoscopically for people that have had other procedures, like a gastric bypass, we can do something called a TOR, or Transoral Outlet Reduction. We use that same device that we look down with an endoscope, and we can tighten up a bypass so that it goes back to working like it was when it was new. Sometimes where the intestine is sewn to the stomach, it stretches out. And when it gets too big, it's too easy to eat. And so people tend to just kind of graze and they start to gain their weight back. So if you're listening to this video, if you're watching us today and you've had a gastric bypass and you think there's nothing else to do, that's not the case. We can make those better, we can make them more functional, and get you to lose some of that weight back that you may have regained. The next thing would be a sleeve gastrectomy. That's what I had. That's the most popular procedure now in the United States. Hundreds of thousands of them being done every year. We offer a standard sleeve gastrectomy. It's all based off of the MBSA-QIP guidelines. You see, we're a certified center now. That's been for the last 7 months. So we do it by the book. And what we find is when you do it that way, these people lose more weight more quickly and they keep it off. So a sleeve gastrectomy, we remove 80 to 85% of the stomach. We don't have to reroute anything, so you don't have some of the other problems that you can get with other bariatric procedures, like a gastric bypass. Gastric bypass is a great procedure, and we now offer that at Sterling Center Bariatrics. A gastric bypass does require rerouting. The stomach is divided into a small pouch at the top, and then you hook the small intestine up to it, and then you tie the small intestine back together further downstream. That's why it's called a Roux-en-Y. You shape it where it looks like a Y. This causes some malabsorption, so some people can have problems like dumping syndrome or can have vitamin and mineral deficiencies. You have to take supplements forever. You don't have to do that with the other options because your GI tract is still intact and you can absorb things normally. Gastric bypass or even duodenal switch, which is something to talk about at a later time, you can have malabsorption issues and you have to take all of these supplements. That works. You just have to take them in doses that are high enough that you are able to absorb things. So those are the things that we offer and things that you can be thinking about. Check it out online, learn more about each option. When it comes to how you're going to pay for it, we'll work with your insurance company. We also have a program through Ameris Bank where they will finance the procedure for you. Great option, low interest rate, very easy to work with. We have people in-house that'll help you get all of that set up. When you start talking about New Year's resolutions, you gotta pay for them when you decide to do it. If you go get a gym membership, they want you to pay for that at the time. We can do the same thing if you do not have the insurance coverage. We'll work with your insurance company, but if you don't have the coverage, we can also work with you on that through Ameris Bank and get it taken care of. It's important to get it taken care of though, because that money you'll get back 2 to 3 times over in the first year alone if you have significant medical issues. All right, so I always get asked also, who's a candidate? Am I a candidate for this operation? Well, if you have a BMI of 30 to 40, you're a candidate for the balloon or you're a candidate for the ESG. 35 and above with medical issues, you're a candidate for a sleeve gastrectomy or a gastric bypass. If you have a BMI of 40 or above with no comorbidities, which would be unusual, but even if you didn't, a BMI above 40, you're a candidate for the surgical procedures as well. Once you learn about the different options, you get that under your belt, you figure out what it is you want to do, you see one of us, we talk about it more in depth. We have a few hoops for you to jump through in advance. Dietary evaluation, a psychological evaluation, possibly an endoscopic evaluation where we have to look at your stomach and make sure you're a good candidate for the procedure that you want to try. Once we've gone through all of those things, then we can talk about moving forward and scheduling your surgery. And that gets you ready to really accomplish your New Year's goal. So those are the people that are candidates. The only other question I really get is maybe somebody that's a little older. Now, we don't start seeing patients until they're 18. That's one of the MBSA-QIP criteria. We only do people 18 and above. There is no upper limit. However, we're reasonable about it. We take every patient on an individual basis. So it depends on what kind of shape you're in. I have done a 72-year-old. I've also had a 65-year-old that I said I didn't think it was a good option for them. So it depends on what your overall health is, what your other medical problems are, and we'll work you through that. We'll talk about it. We'll talk with your doctor or cardiologist or pulmonologist, whoever we need to get with, so that we figure out if it's a good option for you. So that's what I wanted to tell you this time. I'm going to be back again in another 6 or 8 weeks and we'll do another video and we'll see what my weight's doing $226 now, down from $289. You can do it too. Have a good holiday from Sterling Center Bariatrics. Call us 890-3514. See ya.